All right. And we are live. And you know what that means? It is disclaimer time. So, the views and opinions expressed in this podcast are those of the host and the guest and do not necessarily reflect the official policy or position of any institution, nor is an endorsement of any agency or organization. Any views or opinions are not intended to malign any religion, ethnic group, club, organization, company, or individuals, and we respect that people's views and opinions are subject to change. So, welcome back to another week and another episode of Talk Public Health. If you're joining us live on YouTube or listening to a recording of this episode, Naomi and I are really glad to have you back. So, before we delve into this topic for the week, for those of you who are joining the show on YouTube, we want you to just hit subscribe and smash the notification bell so that you're aware of when we upload new content. Furthermore, please explore, like, and follow our other social media channels. And we have many: Facebook, Instagram, Twitter, SoundCloud, all of which the link should be in the description section of this podcast. And we're also thankful to those of you who have left comments about our podcast, which we'll quickly highlight towards the end of this episode, okay? So, what are we tackling this week? Another interesting topic, at least we hope so, where we plan to address enabling environments for public health careers, a bittersweet journey. Even though we're still studying our master's program, these questions have come up in our discussions, and we would really like to talk about it and hear your opinions. And so, just like the format we take for each week, we tackle this topic by answering three main questions. And the first will be addressed by the fantastic Naomi. So, take it over, Lima. Go ahead.
Yeah, thank you, Charles. And welcome again. And the first question for today is how do you navigate building a career in public health? And for this question, it's about some of you who are wondering, finally getting my MPH degree. And maybe you've pictured yourself working in a big international organization with NGOs, governmental or public health institutions, or even research institutes. But gradually, as you go further with your studies, you begin to realize that, maybe getting an MPH degree is just the easy part. But then how do I actually navigate my career? How do I build it up? And this might not be that easy. And
Mhm.
or what are the job prospects for me, or how do I prove myself that I'm competent? There are a lot of people studying public health as well. Should I network a lot, get more language competencies? Exactly, what do I do? And also taking you a bit into the statistics from like graduate large public health schools. We're making a comparison with the US and Europe, so the UK, and we could see that a lot of people that went into public health careers, like a huge percentage of them in the US ended up working for hospitals. And as Charles would say, that's because of the health economics trying to be more cost efficient in terms of costs. And in the UK, actually, a high percentage ended up in the academia and research. And that's
Mhm.
also the second perspective in US, also going for research. So I would say if you're trying to go into academia and statistics are in your favor. But what it doesn't say actually is that maybe it took this respondent about 10 years to get a job, and they might have worked as a supermarket cashier person before responding to the survey. So we don't know behind the lines.
Yeah.
And we could see that actually working for foundations and non-profits or government and the NGOs, like the WHO, for example, the UK had just 7%. So you could see that if you're trying to build your career towards this area, it's actually one of the lower percentages. So
Mhm.
first things first, what do we want you to understand? We want you to understand that this is not to really um, tell you that it's not possible. It's more of trying to make you understand that because of the interdisciplinary nature of public health, other degree holders are definitely competing for the same jobs like you. So you
Mhm.
have somebody that graduated with international relations or international development studies trying to get the same job as you in this area. And for the fact that there's no clear career pathway. And yeah, so this leads to the bittersweet realities of public health, which we will address in the next question. But one thing we want you to know, and that we feel it's usually useful to know exactly, or at least have an idea, what you want to do with your degree. So, for example, it's either you had the previous working experience before getting involved with the MPH. So we have people like that, that they just want to get the knowledge and also use it as a means to step out in their career path. And this is totally fine because you were doing something and now you only apply or use this degree to get ahead in your career path. But of course,
Mhm.
this is not always the case. Some of us are just particularly passionate and convinced that this is how we will make impact in the field of healthcare. And then we decide to get an MPH and go like, oh yeah, I want to get a deeper insight into this field so that I know what I'm doing. So I would say for this category of people, it is very useful. I would say it in huge codes and big letters, very and very always useful to get a
Yep.
mentor that would help you towards navigating your career path, because as we said, like, there's no clear pathway. And also we thought it was very necessary to get to make use of the opportunities during your studies to build your skill set in line with the area you want to go in
Mhm.
your career. So whether it's attending trainings to learn R, that is a statistic language for those that want to go into research and academia, or attending simulations to build your interest in health policy and decision making. So we really feel like these are things to take into consideration, and maybe generally there should be more mentoring platforms created for young professionals starting careers in the field of public health. So, Charles, what do you think?
Yeah, I definitely agree with you, Naomi. There's probably some people who are watching on Facebook Live as well because I have that going, but they can tune into YouTube so that they can actually hear both dialogues. But I think that there's two things that I really wanted to be able to touch on. One is how public health is still a really underappreciated field in many parts of the world, whether that's in the global north or in the global south. So, for example, we had our top public health researcher who found that recently there was a national health manpower plan done in Botswana, and it didn't even consider the public health workforce. And this isn't uncommon for many countries in the global south. However, even in Europe, in the global north, work is still being done on how to harmonize and identify the professional competencies for a public health workforce. So even among the public health world, we're trying to define what makes and what can a public health practitioner do. And so how do you like navigate this? Well, I think I'm going to double down on what you said. And I agree that there's a good need for mentorship. Um, I definitely would say that like I saw the prospect of seeing myself practicing clinical medicine for the rest of my life as a least attractive career pathway as early as the second half of my undergrad. But I knew that I still wanted to contribute to the area of health, medicine, and social justice. So I would definitely say like if there weren't persons in my life who acted as good mentors, I probably wouldn't have found my way in this particular like career pathway. And so I'm gonna say that I was annoying, but my mentors admitted that I'm
Okay.
persistent. But I think that it was so important to have persons around me who didn't judge me, who willingly provided career advice, who connected me to individuals in the field, and trusted me with big projects, despite not having a public health degree. And so I want to be able to return that favor as well. And I think, for persons entering into the field, they should consider who is a good mentor for me to get in order to move ahead with my public health degree. Yep. And what about, I think that this kind of like brings us into our like second question, which is dealing with like the bittersweet realities of working in the public health field. What do you think about this, Naomi?
Yeah, I think like this is a really great question, and actually, this varies across countries, Charles, because I've come to see that in some countries they actually streamlined their public health career. So they integrated it with the medical field. So instead of you uh, being a public health by just practitioner by getting an MPH master's, you actually have to be a doctor, and
Mm-hmm.
then you do a specialization, which includes a master's degree, and then that way you have this whole like job in line for you because you're already like allocated sports. The country has a specific number of public health practitioners, and of course, this is like the best way for you to do it. But that is one exception, or like one or two exceptions. In more reality, it's more about not having a structure. So basically, you have to build your own pathway and keep
Mhm.
pushing for the career you want. In other words, or I would say what you're passionate about, or what made you get into public health. And this is something I think has to be addressed, because given, as you actually already mentioned, that there's a push for trying to make the career path, or the, like, the profession itself more professionalized. And I hope this is something that has, it also has its pros and cons, but something that would make it more visible as a career. Another thing is to be aware of the imposter syndrome. So usually in public health, when you get interested in a particular issue, you're being labeled as an expert. And I think we actually have a problem with that term expert, but
Yeah.
we will address this in another episode.
Mhm.
And there's also this usual sense of doubt you face as a public health practitioner, like, am I doing the right thing? And you're also questioning your judgment. But I think, like, because the field is dynamic, things are changing as well, as you have to be on the top of your game, aware of what you're talking about and knowing things. But it's also okay to question yourself a lot, because if you're not doing that, then you're being complacent. And public health practitioners should not be complacent, because you have to be like, you're in a dynamic field, so you should practice the act of reflection, I would say, and that would
Yeah.
help you navigate this bittersweet reality, I would say.
Yeah, no,
Go ahead.
absolutely, absolutely. Like, I think like, uh, you brought up some really good points there, and I definitely think is that it's important for us to like end up reflecting. I think that I was really interested in some research that our public health researcher provided us, looking into the literature and seeing how a lot of the research around this topic on the public health workforce as a whole, well, it really focused more so on public health workforce as a whole rather than the journey of individual workers. And so I definitely think that like this plays a really, really big issue in terms of job satisfaction. And so like whether people are working in the global north or they're working in the global south, the reality is that some of the bittersweet things that you might see is that you might not see the fruits of your labor paneled immediately. I mean, I know that this happens in other career fields as well. But I know that I've personally worked on reports or I've worked on papers that have never seen the light of day, and you've put so much like time and effort into it. And sometimes I, wonder like if they'll ever come forward. And other times I see like now 4 or 5 years later with some of the stuff, that I wrote that's been suggested being adopted. Um, or we can think about like public health workers, who are in the U.S. who are fighting to have like greater access to like reproductive rights or access to universal health coverage. Like, it's very difficult sometimes. What about you?
Yeah, yeah, definitely. I would say public health can also be a thankless job. So if you are the person that likes graphic gratification, or like instant gratification, maybe you should consider doing something else. But of course, that's not always the case. So yeah, and our work often involves navigating and designing ways for people to reduce or eliminate the intake of products that are harmful for their health. So, and this, of course, will not result in immediate satisfaction. Talking about like reducing fast foods, or cigarettes, alcohol consumption, safe sex, or even imposing taxes to help like fund health and social programs. You don't see this right now. You see the benefit maybe 30 or even 50 years on.
Uh-huh.
So if you're looking for something instant, or you want to be thanked now, like, oh yeah. And I think that's also one of the reasons why it's really hard to debate with politicians with public health
Yeah.
uh, project. And I think we'll discuss this again in another episode. But Charles, yeah.
Yeah. And I think like building back on that, you also have the real realities of racial and gender inequalities that public health practitioners are trying to address, but also impacting them personally. I know that I had recently just read a study titled "More Talk Than Action," not more action than talk. That's what we need, and it was published in the Lancet, and it looked at the way how women and persons who were ethnic minorities were being held back within schools of public health. and it looked at like the 15 like highest ranked social science and public health universities in the world, and it really showed some really startling facts. Like it showed that women outnumbered men at the junior level, but that representation declined dramatically when you moved into the middle and senior academic levels. And if you were a ethnic minority woman, the likelihood or the trajectory path for you to be able to move to seniority almost seemed non-existent. And people really, really, really don't take into account how not seeing yourself reflected in the work around you can actually question your role or your ability to contribute in this particular field. And this even moves like even more into international agencies, and how inequities and how people are able to access work at an international agency can impact the type of work that's outputted by the agency. So, for example, if you consider more developed and larger countries who input money into who put a lot of money into the UN or into WHO, and this helps with either hiring more like young junior professionals or young interns. This like you saw where at the WHO and at like other organizations, you saw an over reliance or an oversaturation of persons coming from the global north when disease burden is really focused in the global south. And I know that a lot of work is being done right now to do some reforms at the WHO and like get rid of the unpaid internships and try and like bring a bit of equity and balance in the hiring practices and representation at its HQ and regional offices. But there's still a lot more to do. Yep.
Yeah, totally. I agree with you, Charles. And this brings up the issues of advocacy groups actually in the public health community working to push for inclusion of marginalized groups in the field. And I think maybe for women, it should be the women in global health, and for we have the global health like workforce network for the youth. So also trying to get the youth more involved, into public health. So definitely, I think like we will see a lot of changes, and we hope that while we're trying to reduce inequities in other aspects, we will also have the chance to get that reduced in our area of work. Yeah.
Absolutely.
Then that will move us to the last and final question,
Mhm.
which is what do you wish you had known before starting an MPH career in public health, Charles?
Yeah. I think for me, I would say before starting at MPH, I would say the best advice or stuff I would have suggested to better appreciate the peers that are around you. They are your best network, and they can be good mentors. I know I, for one, has been very surprised at the amount of experiences and knowledge that persons have that worked around me. So I'd say that's perhaps the one thing I wish I had known before starting an MPH. What about you?
I totally, totally agree with that. Like, I think we share the same thing. But for me, I would say you need to be resilient and persistent in order to
Hmm.
achieve your set goals for your career prospect in public health.
Hmm.
So you just need to keep pushing. Like, some days you might not get what you want, sometimes you get what you want. But what makes you, I think, or what sets you apart from everybody else is just this resiliency. And so maybe a career in public health is indeed not for everyone, and that might be something to reflect on. So
Hmm.
yeah, and for you, the audience, I would say we want you to also answer the question: what do you wish? So if you're currently taking a master's in public health, what do you wish you had known before starting an MPH career
Okay.
in public health? Yeah.
Indeed, we definitely want the audience to think about that question. You can put that in either on YouTube or in like other channels and whatnot. But this is the point in our podcast as we are getting ready to wrap up, where we try to get into audience feedback. So, as we said in the beginning of this podcast, we really value the feedback and responses that we've been getting, either from private messages or comments. And we just wanted to highlight some comments that came through from last week's episode on anti vax behind the curve. And the first one came from Carla, who said, That as a health professional, I think that yes, communication it is essential. People, including myself, forget that health is a service. If people don't feel comfortable with the service, they are going to stop looking for it, even if it is a well proved and beneficial thing. And this links pretty well with the other comment from Annie, who said that as a GP myself, I absolutely agree with your point about not labeling people as anti vaxxers. I think that labeling people only highlights the us versus them thinking and marginalize people even more. When I have had success in convincing parents to vaccinate their children, sometimes it took time to build up trust. And I definitely think that trust is such an important aspect of addressing the anti vax craze. So if you want to read more about what Carla and Annie had to say, just check out the comment sections on our second episode on YouTube, and of course, explore the other channels to see what other people are saying.
Totally, yeah. Thank you, Charles, for that. And and on the same train of thought, we'd like to give our new plug person who just joined the team, and that's why we have a lot of stats. We have a lot of research for you to share with you guys, and we want to thank you, Annie, for joining the team, and she will be helping us keep our content flowing and
Yeah.
remaining and keep the weekly topics exciting for you guys. So yeah, we deeply appreciate your support, and if you ever get the chance to check out her blog, she's also a great storyteller,
Mhm.
and we will put the description of of her blog in the podcast description. And thank you for staying with us so far. And if you have content or ways you want to support the team, please don't forget to reach out to us, and of course share our podcast with your friends. And I'll let Charles let Charles and I know that we are putting out content that's relevant for you and our listeners. Yeah. So, Charles.
Okay. So I guess to wrap up, the absolute last thing that I want to say, or we want to share with you all, is that humanity managed to accomplish such an incredible feat this past week by taking a photo of the M87 black hole. A black hole so massive it dwarfs our solar system, being several billion times more massive than our solar system sun, and being over 55 million light years away. So it took the collaboration of over 200 scientists from across the world to accomplish this feat. So if we can manage to capture some massive and something that was considered unattainable in the past, imagine what we could do here if we were more united on Earth and helped each other out. So today we want to close by saying, be nice to
Yeah.
someone,
Yeah.
show some empathy, because you, me, and everyone here on this planet is all that we have.
Definitely,
So
Charles. I agree with that.
yeah.
Totally. Yeah.
So yeah, thank you. And this is going to end the third episode of Talk Public Health. All right. Farewell, everybody. Until next week.
Bye.
Bye bye.